Let's play a word game. If I tell you Jane has a case of COVID-19, do you think she's really sick? In normal people speak, to have a case of COVID-19 is to be sick with the virus. We think Jane probably has a fever, fatigue, cough, shortness of breath, among other symptoms. But the point is, she is sick and contagious, and that's a reasonable assumption. So when you hear Roy Cooper and Mandy Cohen report that North Carolina has over 232,000 cases, naturally you think that's a lot of sick people. Except in Cooper Cohen government babble, to have a case of COVID doesn't necessarily mean Jane is sick. It just means a positive test result. There may not even be enough of the virus present to constitute an actual infection. In other words, Jane may not be sick nor contagious. Even the New York Times has been critical of the hypersensitivity of the COVID tests, writing up to 90% of positive cases barely contained a trace of the virus. Here's another one. If I tell you Jane is now counted as a COVID hospitalization, what do you think? Well, in normal people speak, a hospitalized COVID-19 patient would mean someone whose COVID infection is so bad it put her in the hospital. But in Cooper Cohen speak, it means someone who's in the hospital for any reason and who is tested positive for COVID-19. Those are two very different meanings. Here are some statistics that our John Sanders pulled together based on our state's COVID data. 0.21%. That's the percentage of North Carolina's population that has active cases. 99.75%. That's the percentage of people in North Carolina who pose no threat to anyone of passing along the virus. 97.8%. That's the percentage of people in North Carolina who have never had a confirmed case of COVID-19. What do these numbers mean? Well, most people in North Carolina pose no threat of infecting others, including our friend Jane, who may be positive but not contagious. And yet, North Carolina is still locked down. Even the World Health Organization says we should end the lockdowns because the economic consequences are worse than the virus. There's no medical nor scientific reason for schools to be closed and for bars not to be serving patrons. The only reason we're stuck in this situation is politics. Politicians like Roy Cooper have weaponized COVID-19 to scare people and manipulate voters. And unfortunately, the traditional media uncritically reports whatever Cooper and Cohen tell them, while outlets like Carolina Journal are locked out of even asking the governor a question. Now, if you have feedback for me, email me at therightaoc@johnlocke.org. And for a healthy dose of COVID common sense, visit johnlocke.org. And for the latest news on COVID and election coverage, visit carolinajournal.com. And while you're there, please consider an investment in freedom so we can continue to bring you the information you need to make informed decisions. Stay safe, stay healthy, and stay informed.